Okay, this is part 4 from the book Prevent and Reverse Atrial Fibrillation, AFib, and CHF, Congestive Heart Failure by me, Pete Rogers. We've been going through the courses of AFib with the idea that if you know the causes of it, you can avoid them and increase your chance of curing yourself without having to take pills or get an ablation. So dehydration is a cause. Low magnesium. You get magnesium from eating plants. Magnesium is located right in the center of chlorophyll molecule, which comes from plants. Pulmonary embolism can be a cause of AFib. An active infection like a bacterial pneumonia or, this stuff over here. Rapidly eating a giant meal that markedly overstretches the stomach can cause vagus hyperstimulation per Dr. John Day, the famous cardiologist. Very spicy foods can also cause AFib episode in some people per John Day. He's kind of like the world expert on AFib. Number 75, vitamin D deficiency due to lack of sunlight. Vitamin D excess due to excessive supplementation. Exposure to excess air pollution. What I did was I went through all the papers and put them all together, all the different things that had significant number of episodes to be reported as potential causes. Having a cell phone in your front pocket. A cell phone in your front pocket is a very bad idea. It's a low-power microwave transmitter. It's been shown to change EKGs. So I would not do that. I even had a cardiologist friend who did that. I thought that was rather stupid of him. He's a real smart guy. He should know better. Okay, exposure to excess air pollution. All right. Cell phone in the front pocket. All right, let me get to scrolling on down. Okay, that can change QT intervals, can increase breast cancer risk. Okay, so that's it for that chapter. We'll go ahead and get a little started on the next chapter. The next chapter is the role of leaky gut, amyloid clots, and microvascular angina in the causation of atrial fibrillation. So this illustration here is abdominal pressure syndrome as described by Dennis Burkitt. He was an Irish Christian missionary physician working in Africa in the 1950s and 60s. And if you're in the medical profession, you might have heard of them with regard to Burkitt's lymphoma. That one is in the textbooks. That's in the pathology books. But there's nothing about abdominal pressure syndrome. And I have friends who are, head guys in abdominal surgery, general surgeons, and they don't know abdominal pressure syndrome. It's not taught in the medical schools or the residency program, but it's such an obvious, simple, easy thing to know and so useful. I know guys who were first in their class in medical school. They're friends of mine, okay? And they don't know this in internal medicine. I thought that was funny because this is basic. I can teach this to you in 5 seconds, okay? Fiber attracts water to the stool, making the stool more bulky. Then a bulky stool in your rectum stretches the rectum, reflex contraction when you're in a safe area, like you just get home, time to defecate, okay? Through a reflex contraction, it's almost effortless. You have a bowel movement, and it comes out looking like a cow patty. Versus if you don't eat enough fiber, meaning you don't eat plants. There's only fiber in plants, no fiber in animal foods. Then the stool becomes dried out from the lack of fiber, and your stool will look like goat pellets or hard Tootsie Rolls, for example. And that does not stretch the rectum. So in order to contract and pop it out, so to speak, to pinch a loaf, if you will, you'll have to tighten up your abdominal muscles. That's called Valsalva maneuver. And that daily tightening of the abdominal muscles during defecation causes increased abdominal pressure. That's why it's abdominal pressure syndrome. The stomach will, over time, eventually start to widen the esophageal opening, the esophageal hiatus, and some stomach will pop into the chest, so that's called a hiatal hernia. You'll get acid reflux in there, that's called GERD, gastroesophageal reflux disease. Increasing the risk of Barrett's esophagus, meaning abnormal lining of the esophagus, and that can progress to cancer in some people. Diverticulitis, a back pressure on the sigmoid colon. You can have an outpouching of the sigmoid colon wall, that's diverticulosis. Those can pop, that's diverticulitis. And again, the smartest doctors don't know this. I know a guy who's a top-notch orthopedic surgeon, excellent in his field, but he got all this stuff. He didn't know anything about diet. Appendical lith, meaning because the stool's dry, it can form little rock-like structures, and they can block the appendix. So lith means stone, appendo means in the appendix, so appendical lith is a stone in the appendix. Sometimes it's called fecalith, a stone made out of feces. That'll block the appendix, and then the mucus glands distal to that will continue to secrete their mucus, but now they can't join with the rest of the right colon, the cecum, so the appendix can pop. That's appendicitis. Okay. increased periumbilical hernias, but there's no room to draw it on here. Increased rectal hemorrhoids because of down pressure on the rectal veins, down pressure on the veins in the scrotum, so varicocele, dilated veins in the scrotum. I see those every day. Dilated veins in the leg, varicose veins. So women like to know that. So this is all abdominal pressure syndrome. So anyways, it's pretty easy to prevent. Just eat your fiber. We'll stop it there for today, and then next time we'll come back and we'll go through the issues of leaky gut and how that can, and amyloid clots, fibrinolytic clots, microvascular angina, and all those things contribute to increasing the risk of AFib.